Hi, my name is Jamie Corsa. I'm a Wilson State College student, and today I will be performing a newborn assessment. So first I will go ahead and knock on my patient's door and enter. I do notice mom is at bedside with baby. So I'm going to go ahead and introduce myself. Hi, my name is Jamie Corsa. I'm going to go ahead and be your nurse today. So then just let the mom know that I will be performing a newborn assessment. So I'm going to go ahead and take the baby here in a minute over to the lamp warmer. So first I'm going to go ahead and perform hand hygiene and don gloves. So first what I want to go ahead and do is check mom's wristband, make sure that I have the right patient, and then I'm going to go ahead and check baby's bands, which are 1, 2, and there's a third one here, and making sure it is matching up with mom's. So now mom again is bedside, so I'm going to go ahead and start my assessment. So first I'm going to go ahead and start at the top of the head. I'm going to notice that the anterior and posterior fontanelles are still open. They are not indented in, which could be a sign of dehydration, and they are not bulging, which could be a sign of ICP. So those look good. They are soft. Suture lines are approximated. So now I'm going to go ahead and go down, and I'm going to do the temperature. I'm going to go ahead and go put it in the middle of the axillary, and I want to go ahead and hold baby's arm against there, waiting for a beep sound with the temperature. So while I'm doing that, because it takes a minute, I'm going to go ahead and notice that the baby's eyes are symmetrical, ears as well are symmetrical, mouth is moist, good in color. I can see that there is no hole on the top of the mouth in the roof. I then am going to notice some Epstein pearls, which are a normal thing. And then I'm going to go ahead and notice the nose, there's no flaring, as well as the baby's head is moving freely, which means that the clavicle is okay. So now I hear a beep, and temperature for baby is 97.7, which is normal. So that's a good temperature. So I'm going to go ahead now, and I'm going to listen to the baby's lung sounds, but before that I'm going to go ahead and watch the respirations for a minute or so. So I'm just going to do this for purpose of the videos for a couple minutes here. And respirations are 45, which is a normal limit for a newborn. So I'm also going to notice that the chest, there is no retractions. It looks good. Nipples are symmetrical as well. Now I'm going to go ahead and take a listen. And I also want to say that this is a newborn stethoscope that I'm using. And I want to go ahead and do this for 1 minute. Purpose of the video, I'm just going to do it for a couple of seconds. Okay, lung sounds sound normal, so we're gonna go ahead now and move on to the heartbeat or the heart rate. I am gonna listen to the newborn's heart and to make sure I'm not hearing any extra sounds, and I'm gonna go ahead and count that heart rate again for 1 minute. And for purpose of the video, I'll just do it for a few seconds. And I'm going to go ahead and note that it is 147, which is a normal limits for a heart rate for a newborn. And there were no extra sounds, so nothing that indicate a possible murmur. Now I'm going to go ahead and I'm going to take the diaper off and put it down a little bit. And while I'm doing this, I want to go ahead and notice that there is no scrapes, abrasions, the color of the baby looks good. And now I'm going to go ahead and look at the abdomen, which is flat and soft. That looks good, as well as the umbilical cord is still a little bit moist because she was just born, and there is no drainage or odor. So now I'm going to go ahead and listen to the bowel sounds, make sure they are all active in all 4 quadrants. Okay, so bowel sounds are active in all 4 quadrants. Now I'm gonna go ahead and I'm going to take down the diaper, which I will get the baby a new diaper when I'm done. And I'm just gonna go ahead and look at the genitalia. It is a girl, and everything is atomically correct. As well as I see a little bit of pseudomenstruation, but I want to let mom know that that is normal, and she got that from hormones coming from mom to baby. And I also want to ask mom if the baby has had a bowel movement or has voided. Mom did say yes. I want to let her know that that is normal. They are supposed to have that in about the first 24 hours. Now I want to go ahead and flip over the baby here, and I want to just take a look, and I want to check the spine, which is straight in midline. There is no dimple or tuft of hair, which may indicate spina bifida. I am also now too going to listen to the lung sounds on the back side, so I don't have to keep turning the baby over. Again, you would do this for 1 minute, which everything sounds normal. Now I want to go ahead and put this new diaper on the baby, and then I just want to take a look, again, kind of looking at the skin. There is good range of motion. I also am going to check and make sure that the nail beds are pink and good. Capillary refill is good. She does have 10 fingers and 10 toes, so that is good. So now that is my assessment, so I'm going to ask mom if she has any questions to go ahead and let me know or ask someone, and then I would go ahead and wrap baby back up and give it to mom, as well as I would perform hand hygiene and make sure that I document everything. Thank you.